You start with screening tools, like CRP is a marker that I use in my blood work. If you get your blood work done annually at your medical doctor, you need to ask for CRP. It's incredibly important. These other tests are more advanced testing that I do after I look at other things to make sure that these are not things that I necessarily start with. I do look at cortisol, though, in the neurotransmitter hormone panel, which we'll talk about in a bit. I do leaky gut testing on occasion, depending on the patient's symptoms. And then there's this thing called LPS, which is induces depressive symptoms, and I'm going to talk a lot about that in a couple slides. So these are things that when we start looking for objective findings to start finding the underlying cause of the depression, these are the things that we start looking at to try to start ruling out. I'm looking to rule out and rule in what's happening. And it's as much as ruling out as it is ruling in. You know, I'll go through people's blood work and I go through it in very detail and say, oh, that's not the cause, that's not the cause. And then we finally get to the areas that are the problem. And then we start focusing in on those things. So there's these things called LPS, and they're lipopolysaccharide endotoxins. That's a mouthful, huh? We'll just say LPS for now, and they're found on the outside of gram-negative bacteria, and they're in our gut. And they're called microfilms or biofilms. And they've become a prominent issue in our mental health because we've used a lot of antibiotics. We've used a lot of things to kill off the bad guys. And you get LPSs inside the gut and are attached inside the gut, and they are bad, bad, bad things. And when we get LPSs, you start getting autoimmune diseases, you start getting chronic fatigue, inflammation. It causes a lot of inflammation in the body, in the gut in itself. And in a slide or two, you'll see where it ends up in the mental health issue as well. Microbes and dysbiosis. Dysbiosis is the dysregulation of the normal bacteria in the gut. And if you've had antibiotics even once, you've killed off your normal flora. Okay? So if you've taken a routine or you've put your kids on multiple antibiotic therapy, it's probably suggestive that their gut lining is out of balance, and it's going to cause dysbiosis, and it's going to activate mental illness of whatever kind it is, depression, anxiety, immune activation. This is a research piece here that directly correlates bacterial or dysbiosis regulation and mental health issues. Here's another slide. This one was in neuroendocrinology in 2008. An increase in these translocations of the PLS is another pathway which explains the inflammatory pathophysiology of major depressive disorders. This is well researched, and your medical doctor has never seen this article. I will guarantee it. Never. They don't look for it. They don't do anything. They don't know what to do about it anyway, even if they do look at it. And so when you start linking these research, the actual solid research that's finding some of these underlying causes of mental health disorders, depression, anxiety, OCD, schizophrenia, all of these things, you're going to see that there's a whole host of a lot of information out there that really supports a more natural approach to dealing with these issues.